So if we look at, we all know there are various forms of stresses, but if you define it further with what it can do to the body, it causes some reactions that requires physical, mental, and physiological adjustments. Now, most of those, you can't look at the bad things that stress does, but are there any benefits of stress? Why was it necessary in the first place? You can't liken it to, without using jargon. If you have a car engine, for example, it works best at a certain temperature. If it's too cold in the morning, you can't start it well. After it has warmed up, it's working optimally. The same with the mind. So a little bit of stress is good for the body. If it's too much, then again, one becomes disorganized and you can't decompensate. Now, the effects of prolonged stress, those are many, and it can lead to raised cortical levels in the body. These are endocrine changes, and also raised blood sugars, which can cause hypertension and so on. So it needs, if it's sustained for too long, it's harmful, and hence the need to manage it. Yeah, so I talked about the benefits of stress and the effects of the prolonged stress on the body and the need to manage it. Right. So what are the common causes of stress among students? From studies, they list these factors. There's high parental expectations. Nowadays, along the line, they start carrying the high achievers on their shoulders and lots of celebrations as you come to the university. So the whole village is looking up to you. It didn't happen nowadays, but along the line, this came along. So that puts a lot of pressure on these students to achieve. And when they arrive at the college, they find that the course is very vast. So whereas you thought you had mastered everything at the primary level, secondary school level, you find a whole new world of very complicated things. And then the teaching methods, again, you are thrown into the sea, so that contact between the teachers may not be there. The universities are quite different, and they are also adjusting. So they are going through a lot of pressures from all sides. And then there is the overcrowding. Overcrowding is a source of stress, just like noise and so on. So environmental factors can also lead to stress. And the stresses, as they go through the years, the stresses they undergo are different. I've highlighted some of those that they can experience in the first year. The change of environment and so on. In second and third years, again, the courses will become more complicated. When they are about to exit, 4 through 6 years, they start seeing patients and planning for their other life, and now the added stresses of getting a job and so on. So there are some studies. I've just picked some random ones you'd find on papers that have studied stress among medical students, and they find that suicidal ideation is quite high. It's at 25%. You go from suicidal ideation. One is the being tired with life. So you have a death wish. And then you wake up to say, I wish I were that and that. But then the idea comes, and then after that there is the planning, and then the attempt. So it's graded. So it doesn't mean that all these 25 will go through the whole stage. And then there are also many studies looking at suicide among health professions. Recent studies have shown in the US and UK, I think there is a drop among the doctors, rates of suicide, but it used to be quite high. But the other professions, the nurses, the lab technicians, is still high. Now, what are the barriers to effective stress management? These are some of the traditional beliefs. We were taught by some teachers, and they had the idea that you needed to be tough. I remember one student asking a lecturer then to maybe simplify things and not to be too tough on them. But he said life is tough outside. You should be trained early. So this idea that you should be emotionally strong is really not true. Because I've had some students who are stressed, but if taken care of, they go up and make quite good physicians. So it doesn't mean that you weed out weak students. Now, help seeking should not be considered as a weakness and stigmatized. Okay, but it should be encouraged. We could talk more about that, but because of the time, we'll move on. Now, another hindrance is lack of appropriate services, confidentiality, and stigma. You can imagine a medical student who is stressed, he wants to consult you. Does he do it at the clinic where you are, with the other patients? Is it appropriate to do it at the health facility? What are the university health services? How are they organized? And do they have the appropriate staff to refer the patient to the various institutions or people to help? Now, one way, there's a paper that I came across, it said it encouraged the lecturers to also write about their experiences. If they have had mental health problems, if they wrote about this and came out in the open, probably the students will also be encouraged to do that. And he actually wrote about his own story. Now, if we look at the curriculum, I looked at the KMP DC, I think I got it correct, the one on the website. They have a common core curriculum there, and if you look at it, there is the content of behavioral sciences. And I know from experience, I've taught at University of Nairobi, Maseno, examined also at Moi University, locally here. And I know that behavioral sciences are taught in the preclinical years. And some, due to some historical facts, we used to do it in second year at University of Nairobi, but it was moved to first year. Now, when you are teaching some of these concepts, they are really misplaced at that particular time. I should think so. So, because they are even some starting in the first semester, they have no knowledge of physiology or biochemistry and so on. So, and giving them clinical examples becomes very difficult. Now, again, they go to fourth year. Fourth year now is psychiatry, and there we deal with the abnormal behavior mainly. But the concept they should have learned early. Now the courses are discrete, so they have done behavioral science, and as a student you focus on passing exams. So if you have passed that one, you forget it. When you go to the fourth year and so on, you try to revive some of these theories on the psychology, sociology and so on, and to them it's like a bottle. They don't want to, and yet it's the foundation. I saw some students around here, probably they can relate to this. So if we look at it, maybe this would need restructuring. It's also a cause of stress. Now, if we had the theories of stress, probably the introductions should be first year, but I think in the curriculum should be restructured such that you have a refresh in the fourth year again, so that they look at again on these psychodynamic behavioral theories and so on. Because when they go to psychiatry, let me go back a bit. the duration of the courses, the time that they have for these rotations is also quite limited. Although it is 6 weeks in theory, but you find that it's only half a day or less than half a day that they spend in psychiatry, so it's very difficult to teach all this. So at least this is what the content, what it should contain, these theories. Stress, we have talked of it as an adaptive mechanism. Why was it necessary? What are some of the evolutionary theories about it? They should know this basic fact. I think most of you here would know that if you are stressed, it's either the fight or flight kind of reaction, isn't it? So why was it this necessary? You know, the basic functions that are life supporting are in the lower sections of the brain, like in the reticular activating system. So there are things that occur outside your consciousness. So if you are stressed, and this was a life-saving. If you see a lion, for example, you are not going to wait to process it that this is a hairy animal and so on, it's a lion, it can kill. That space of thinking would take time, and you'll be gone before you process that. So the body adapted. As you said, it kicks in this adrenaline and so on, so you can run even without thinking. But now the dangers are like, if you find things like impending exams, the stresses that we have talked about, but again they elicit the same symptoms in the body. Fast heart rate, the breathing and so on. But this has to be, you have to override that. And there are techniques which they can be taught to do that. So these are some of the evolutionary theories of emotions and stress. And then the psychodynamic theories, you have heard about ego defense mechanisms. So what is being defended? It's your ego to make it so that you can function. Say if you decompensate, for example, if you hear very bad news, you need to defend, to adapt some mechanisms to defend yourself, to make you function over that period. Now there are bad defenses and good ones. But they are good, psychotic, immature, neurotic, and so on. One good way of remembering this is if you are using a defense mechanism that makes other people around you suffer, then you are probably using the psychotic, immature kind of defenses. So, but if it's neurotic, you suffer yourself. You feel the depression, anxiety, and so on. But then there are the mature ones. Okay. Now, I've stressed the need for, if you are doing the behavioral sciences in the early stages, the teaching there is mainly based, like the learning theories and so on. They talk about the animal, the rat experiments and so on. But we need to move that to give clinical examples of how this works so that they appreciate it better. And also the cognitive behavioral theories, which are very powerful and lead to theories of how you can manage stress. Things like cognitive distortions, cognitive triad, and mental schemas. Sometimes people ask me, they have seen a person talking to themselves, talking alone. They go, maybe you have experienced that. And they ask me, is that normal? What do you think? It's normal or not? It's normal, yeah. I mean, everybody talks to themselves, but not loud. That is the way you think. You think by having a silent conversation with yourself. within your head, isn't it? So the thinking that can affect the feelings and so on. More about that later, but the psychodynamic theories, I think these ones, you all know about Freud, Sigmund Freud, and these theories, these ones of the, started with a topographical model. The important things not there are that it's like an iceberg. Maybe not a good example to give here, but we have all seen. You can imagine ice floating. The large part of the ideas or the feelings are in the unconscious part, with only a few at the conscious level. Okay? But we revised this later and thought that was too simplistic. So the ego, you can see it goes through from the conscious to the conscious, and a bit also in the unconscious level. Okay? That's the one that deals with the reality. The superego is the one that deals on, okay, you can liken it to the policeman of the mind. One that tells you this is wrong and that is right. This is wrong, that is right, and so on. And the ego, the impulses. So when we are talking about the ego defense mechanisms, that's what we are talking about. Some examples there, ranging from the psychotic to the mature ones. All right. So if it's totally disorganized, you can have psychosis. Psychosis is a severe form of mental illness and decompensate. People can suffer stress, and some may go into what the laymen call mad. At the second level, you can have the PTSD, aggression, the self-cutting, self-harm, and so on. Not very common here, but I've seen 2 or 3 female patients who cut themselves. Okay? It's more common in the Western setting. Okay, and some paranoid ideas. And the third level, displacement, repression, and so on. Phobias, and have all this. Okay, these theories, they should be in the curriculum, and they should be taught and retaught, as I said. They are very powerful in the management and understanding the stress. The cognitive triad. This was from Beck's ideas, Aaron Beck. Okay. The way our thinking can affect the way we feel and the way we act. Okay. An example is given that thoughts are very powerful. Just to illustrate this, I'm not going to ask you to do it because of time, but you can do it privately. If you tell people to write the name of somebody they love very much, those who want can do it now. You don't have to do it. Anyone you love very much, yeah, and then right below it, I wish this person dies tonight. Okay, did anyone do that? So there are no psychopaths. Some people actually do it. But why can't you do it? It's just a thought. Isn't it? Is it true? So thoughts, people liken thoughts to reality, which is not really the case. We see in the Socratic reasoning that you have to take them out of that thing. But a thought can make you feel so bad and also affect the way you act towards others. Now the other concept you need to include in the curriculum are these mental schemas. It's the way that you organize and process the information in the environment. You know, when kids start talking, they can call any male person daddy. or any four-legged animal, a horse or a cow, depending on where they come from, and so on. So they are developing this schema, organizing these blocks of understanding the world. But now, if that is faulty, I copy this from that source. Now, cognitive schema. We like to group things. But that overgrouping can lead to problems. So if you liken some things that you hold as truth, but are they true? Like you think you should be liked by everyone. Is that true or not? You want to please everyone. It could arise this, I think there's another picture. Anyway, we'll see it later. But those schemas, the ideas that we have in the mind, can affect the way we behave towards the others. Now, the cognitive distortions also, patterns of thinking. Fortune telling is examples there. Fortune telling. There are people who are so pessimistic. If you ask them, how was your week? They focus on the bad things. Some on the good things and so on. And they are always foretelling bad things will happen. They are trying to read the minds of someone. He doesn't like me because the way he looks. If you meet somebody, greet him and he doesn't greet you, what do you think? Maybe he was just busy. Yeah. But then that can affect the whole way you think and so on. And so on. And this catastrophizing, making things seem so much out of the bigger than they actually were. Okay, let's move on. I think my time is, I have 5 minutes. So these are how you can develop the negative automatic thoughts we are talking about. So you can see on the right there, the core belief. If somebody has that schema, he is bad. So he tries not to let anyone down. He thinks people are angry with him and so on. You can make circles and think about this, how that the core belief can affect the way you behave towards others. That's causing stress. Now, stress management, I understand I have one of you should approach the person with stress, student or whatever, before you just send them off for counseling or something like that. You should have a holistic approach and think what is really causing stress in this person. And this is also for patients. Could be biological, psychological, or social. And you know the age at which you get students, they are in the late teens to early childhood, to early adulthood. And that's when a lot of these diseases, bipolar illnesses set in, the schizophrenia sets in, and so on. Substance use is there, so make sure that you are not dealing with these comorbidities. Is it just purely stress? Once you have done that, then you can take one of these approaches, the cognitive behavior therapy approaches, derived from those theories, identify the distortions in thinking and so on, and do cognitive restructuring. And also things like meditation, mindfulness practices, autogenic training. Nowadays, these are in the internet. You can Google and read more about. And then and do cognitive restructuring. Socratic questioning, is it, always ask yourself, is it true what you are thinking? It's like in, what is the evidence for this? Does worrying about this problem make it better or worse? And one other thing you can do is ask them, what advice would you give to somebody who was in your situation? We find people are very good in giving advice. Whereas they don't give that advice to themselves. But if you tell them so and so is having this and this, what do you think they should do? And they come up with answers. Now these are examples of this Socratic question. Okay? Clarification, challenging assumptions, and so on. There is a patient I saw a few weeks ago. He had gone to hospital and he was very upset because they had done all the tests and the doctor told him he was okay. There was nothing wrong with him. So he said, how can that be? So is it the correct way to tell him? For him, he is suffering. But then you could go through these approaches, assess his stress and so on. There is a whole lot of way of handling that. And I don't tell patients impractical things that I've also had people come and say, the doctor told me that I'm thinking too much. I should not think. What do you think about that? If you try not to think, that's when you think. So there's the pink elephant experiment. You have heard of it? Yeah? So you ask people to picture a pink elephant. Elephants are not usually pink. Picture one in the mind, and then you ask them for the next minute or so. Try not to think about the pink elephant. So you find that the mind goes back there. So these are not very helpful. So things like relaxation, controlled breathing, but these are very simple things. But so if the anxiety comes in, you can tell them how to breathe. This one you can even do in the office there, or so they can do it themselves. You take them through it, and then it helps. Breathe in, and while you are counting 5, hold it for while you count 6, and then exhale slowly as you count 7. You can try it, and also diaphragmatic breathing, putting one hand on the chest, another one on the abdomen. Try to breathe only with the abdomen for relaxation. Exercise, very important, extracurricular activities, keeping a journal and so on. So all these can be done. Biological treatments, the medications should be used to a minimum, okay? I've had medical students use a lot of propranolol when they are going for vivas and so on, and amphetamines when they want to read. So I'll conclude, I think this is the second last. Behavioral sciences are inadequately covered from what I've said in the syllabus, and teaching methods within the same college are not always harmonized, and this also is a source of stress. You find most teachers using different methods. Some is the traditional lecturing method, and some is so when the students come and you are trying to fit your method to them, they find that if you give them homework, they find that stressful. They don't carry their duties well, and so on. And the link between the theories and practice. I think we had a lot of talk like that in the morning and then limited education. So I ended up with these recommendations. Review the curriculum for appropriate content. That. Because also the KMPDC content, you will find it. These things are not there. Or maybe it was paused, so they omitted it. And the timing when it's given should be right. Uniform method of teaching, so that as they enter first year, they know this is the method that is used in this college. So when they come, in places where it's done, the students are so good at it. When they give them a problem solving, they elect their leader, their scribe, and so on. They identify the problem so that it makes work easy, even for the lecture. If you have a librarian assigned to students or various departments and the resources, these are things we could do easily without looking for donors outside. And then I also thought that multidisciplinary teaching is also very important, so that when you are teaching the clinical subject, maybe I'll focus on psychiatry because that's what I know most. So if you are teaching the clinical subject, if there is a clinical psychologist there to add on about those theories and so on, it makes more sense to them, or a clinical pharmacologist, because we do a lot of that in psychiatry as well, and now he had passed pharmacology. So when again you are talking about the side effects and so on, the compliance, and it seems a bit misplaced. So different teachers, different multidisciplinary, and you can do this in form of seminars where you hold in with different people from different disciplines to tackle one subject. Then last two, encourage the students and healthcare staff to seek help. University health facilities should also include multidisciplinary teams for ease of referral and consultation. Apart from not everything just needs counseling. The vast majority will do, but a few students would need much more focused work with them. I think thank you.